as a rhinoplasty practice, obviously we've had the occasion every so often of a patient who post-surgery somehow, got hit in the nose, and the question very frequently is, did I re-break the nose? What do I have to do to prevent myself from breaking the nose again? So let's talk.
Really common, first of all. Let's say despite having that conversation before surgery, and even when patients take the most care possible, things happen. Dogs jump up, little babies do the bobblehead thing, fast-moving doors, etc. So inevitably you're going to get a little bump on the nose. The question is, when is it significant and when is it not?
Yeah, typically what we tell patients is that the first couple of weeks, if you've had a procedure where the osteotomies had to be done, where the bone itself had to be moved, typically the sort of standard answer is that by about a month you have about 90% of the original bone strength there, and by 6 weeks it's upwards of 95%, if not 99%. So it's really the first 4 to 6 weeks that you have to be a little bit more cautious and take care.
That said, your nose is not glass. If you roll over in bed and accidentally touch your nose, you're not going to wake up in the morning with your nose on the side of your face. But if you get a good bump in the first few weeks, it is possible that you can cause a little micro shift in the bones and come back and feel like something's changed. It's not 100% straight anymore. So the best thing to do, if you have a little bit of swelling, is put a little ice on it, call the office, and then we'll schedule you for an evaluation to see whether there's been any significant injury and go from there.
Yeah. But on the positive point, just be aware that in the vast majority of patients, when you get a little bump, it does hurt, you'll feel a little ache, but you're not really breaking anything again, you're not causing any real movement. It hurts, just like when you first went through the surgery itself, there's a little bit of ache, it hasn't healed all the way, so you're going to get a bump, you didn't break anything, you didn't really cause a problem, but let your surgeon know so that that you can take appropriate care.
So long story short, don't panic, don't be too worried. The greater likelihood is that it's all going to heal up just fine, but best to let us know.